ready. We're ready. Monday. Start off the day today, Monday. Phenomenal regenerative case. Last week I had a young gentleman who presented to my office with pain to the medial aspect of the left ankle / leg. This patient is a CrossFit athlete, an avid one too. The patient has been battling pain to this area for several months. Now it's affecting his daily life activities. Anatomy 101. There's a very important tendon, right? 2 or 3, but one very important tendon called the posterior tibial tendon. This tendon, the job is to hold up the arch, okay? The arch. But also, it plays other major roles in the ways that we walk and ambulate and exercise. And for whatever reason, which we sort of know why, the tendon is suffering. Whether it's a tendinitis, an inflammation, whether it's a tendinosis, a degeneration, partial tear, interstitial tear. We did get an MRI, but the MRI revealed some other things. Again, when we get an MRI, you essentially, anything and everything in its way, it will pick it up. But it did not really pick up anything in this location. It was mostly sort of in this location, a little bit of interstitial tearing of the tendon itself. But we were able to really look for that one specific spot, which is the spot that I've marked right here. This is the tibia, okay? I drew out the tibia, which is one of the 3 bones that make up the ankle. And again, this is, again, right here and right here, this is the tendon, it runs right there. Once it comes around to this area, you know, this is an area of a little bit more, less blood supply. So if the tendon, sometimes the tendon tends to get injured in this area. I spoke to the patient in great length because he's an avid CrossFitter, he's young, fit, and he wants to get back, right, to all of that and to his daily life activities. I recommended that we try a PRP injection, a platelet-rich plasma injection in conjunction with ozone therapy as well, to continue our efforts to maximize improvement and minimize any long-term complications. And that's what we're going to do today. So without further ado, let's go ahead and get busy. Okay. So the first thing that we're going to do, and I'm going to talk out loud because I told the patient that I would definitely talk out loud and kind of give him a little bit of, and I do that a lot with the patients, play-by-play, so they know exactly what to expect. So the first thing that I'm going to do is I'm going to clean the area with alcohol, okay? And again, we've already marked the area with the ultrasound, which is sitting to my right. Okay, before we do anything, we always check with the ultrasound, make sure we're in the right location. So alcohol, okay. This is the alcohol. And I always tell patients, like I've said it before, over and over, the patient will feel a little bit of pressure. In this particular case, we've decided to go with a very, very high volume of blood to a very high concentration of platelets in a very low volume, okay? So this is what I mean. So we went from a lot to very, very little. But in this syringe, there are billions, right, of platelets, which contain all the growth factors and important cells that aid in the regeneration and of the tissue, in this case the tendon, and as well as obviously our goal is to reduce the inflammation. So we're going to go ahead and spray some cold spray so the patient does not feel anything, okay? And like I always, this, I like, everyone is different, everyone is different. And, you know, we're going to try to be, like always, as gentle as possible. Okay. Do we have a hemostat? Hemostat? No? Okay. It's okay. So, here we go. Cold spray, my friend. Cold spray, excellent. Little pinch, here we go. You're doing great. Excellent. Now, what you are going to feel is pressure, okay? A little bit of burning. You'll see it now. There it goes. Okay, you're doing great. Fantastic. You should be saying, wow, Dr. Wagner, you're doing great as well.
I say, get it out, please.
Okay, super. So, we're almost done. I just have to now put... It's okay, you're doing great. Okay, let me have the ozone, please. Ozone. We want to make sure. Okay. And we're done. Okay. That was it. We're all done.
Okay.
The patient, we're all done. Patient did extremely well. Now that we're done, now that we're done, okay, you guys can hear the patient. He's there is a little bit of discomfort, especially after. Let me just put this here behind. There are patients that are afraid of needles. There are patients that are afraid of procedures as such, and unfortunately, you know, we try to really minimize the impact as much as possible. The patient in this particular case, I will tell the patient that this discomfort will last about 5 to 7 minutes after the injection, whether there is local anesthesia. In this particular case, I also decided to not anesthetize the area because it would have taken several injections, and I did not want to put the patient through that discomfort. It is not it's not something that I would have liked to do to this patient, to the best of my ability, to make sure that it's a flawless experience. So again, what did we do? Patient presented, a very active patient, presented with pain to a very important tendon right here. Okay, I drew it out, and we'll go ahead and now kind of erase all that. And then we decided to, before we do anything, right, because the patient came in here thinking, I need surgery. There are ways to prevent surgery. There are ways to avoid the knife. And that's exactly what we do here at Jaws Podiatry. Like always, I appreciate everyone that is following us. Please share these videos with your friends, your Facebook friends. I think they're very educational, and it will teach a lot of people a lot of things that they never knew about. www.jawspodiatry.com, Facebook Jaws Podiatry, Instagram Dr. Toe Jam, and last but not least, to all my loyal followers on Jaws Healthcare YouTube channel. Have a wonderful week, everyone. Booyah!